VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Please see important safety information at the end of this video.
As a very passionate doctor of optometry, I believe that glaucoma is something that is right in the optometrist's wheelhouse. It is something that as a primary eye care provider, we are on the front lines of identifying, managing, diagnosing, and treating.
My goals in choosing a glaucoma treatment is ease of use for the patient. This is a chronic, lifelong condition that it's something it's going to be in their life forever. So it needs to be something that's easy to insert into their daily routine, as well as being something that's very efficacious in a single medication.
Well, when I'm choosing a glaucoma treatment, I'm looking for something that's going to be effective and convenient for the patient. If the patient isn't taking the medication, then we're not going to get to our target pressure.
If I were talking to a colleague who's never used VYZULTA before, I would tell them, just try it. Begin with it. Use it first, call the Bausch & Lomb rep, get your samples, but start out of the gate with that. I think if you have to, look at your targets and hit it, the agent did extremely well. And the research, if you look at, the phase 3 data that came out, we're talking about up to 9.1 millimeter drop in mercury. That's a significant drop. You're going to be likely to hit your targets with that. And the only way you're going to know that is to try it. It's convenient on the patient. And now you have this nice comparison to be able to look at and realize why that's such a good agent. I think the other advantage is keeping in mind the hyperemia rate in the clinical trials was about 5.9%. And actually, I see that clinically as well, which patients appreciate. So I think you're missing a lot of opportunities if you don't utilize VYZULTA from a patient convenience, from efficacy, and even from hyperemia rates.
We want to be able to diagnose the patient early, communicate the importance of regular follow-ups, and the adherence to whatever treatment we typically prescribe. For newly diagnosed patients, which is definitely the majority of the patients that I'm seeing, it's a prostaglandin analog. And if I have my choice, VYZULTA will be my first choice. We tell them about the benefits of this particular medicine, one drop once a day with a high level of efficacy, and that usually is a message that resonates well with patients.
Important safety information. Increased pigmentation of the iris and periorbital tissue, eyelid, can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes, may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with a history of intraocular inflammation, iritis, uveitis. VYZULTA should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in aphakic patients, in pseudophakic patients with a torn posterior lens capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the number of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of VYZULTA and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater than or equal to 2% are conjunctival hyperemia, 6%, eye irritation, 4%, eye pain, 3%, and installation site pain, 2%. Please see full prescribing information at VYZULTA.com.